Hello, my name is Lance, and today I'll be presenting my workplace safety health promotion program for registered nurses. Registered nurses are like the backbone of our healthcare system. Their daily responsibilities include like assisting patients, administering medications, performing wound care, operating medical equipment, and communicating critical information to physicians and families. They work 8 to 12-hour shifts, often on their feet the entire time, lifting and repositioning patients, managing medical emergencies, and providing emotional support to patients' families during some of the most difficult moments of their lives. These physical and emotional demands create serious occupational health risks that this program aims to address. Before developing any program or before developing any health program, promotion program, we first need to understand the scope of the problem. For this program, I use two types of assessments to gather data. The first is a fictitious, anonymous digital survey that I would dispute through the hospital's HR department via email to all nursing staff. The survey asks nurses to report any injuries or health concerns that experienced over the past 6 months, including musculoskeletal pain, heel-stick injuries, experiences with workplace violence, and symptoms of burnout. This gives us a direct information from the people we are trying to help. The second assessment uses real data from the credible sources. According to OSHA's 2024 Injury and Illness Report, registered nurses accounted for 58,411 workplace incidents in 2023 alone, making up 8.2% of all non-fatal workplace injuries in the U.S. private sector. The CDC also reports over 1 million needle-stick injuries occur in healthcare settings annually, and according to a 2024 National Nurses United survey, over 80% of nurses experienced workplace violence in 2023. These two assessments together give us both the real world context and the specific data from our own workplace. Based on both the real data and the fictitious survey results, four major risk factors were identified for registered nurses at our facility. The first is musculoskeletal injuries, which result from repeated patient lifting, repositioning, and long hours of standing. Research shows that nurses have a 70% higher risk of lower back injuries than the US population. The second risk factor is needle-stick injuries, which expose nurses to bloodborne pathogens such as HIV and hepatitis C. The third is workplace violence, with over 80% of nurses reporting at least one incident in 2023. And the fourth is burnout and emotional exhaustion, with 75% of nurses reporting burnout symptoms within 2 years of practice. As you can see in the table and graph on this slide, out of 120 nurses surveyed at our fictitious facility, 94 reported musculoskeletal injuries, 48 reported needle-stick injuries, 67 reported experiencing workplace violence, and 102 reported symptoms of burnout. These numbers confirm that all four risk factors are serious problems that need to be addressed. Now that we understand the risks, we need to identify who will be involved in this program. The gatekeepers are the decision makers who have the authority and budget to approve and implement the program. These include the hospital CEO and an administrator who approves overall funding, the director of nursing who oversees all nursing staff policies, the HR department director who manages employee data and communications, and a risk management officer who ensures the program complies with OSHA regulations without the support of these gatekeepers. The program cannot move forward. The executive participants are the people who will actually carry out the day-to-day work of the program. These include charge nurses and floor supervisors or the occupational health nurse on staff, the hospital safety committee, and the staff registered nurses themselves, who are the target population and whose participation is essential for success. With the gatekeepers and participants identified, we can now establish our goal and objective with the and our goal and objectives. The overall goal of this program is to reduce workplace injuries, improve mental health, and increase safety among registered nurses at Sunshine Medical Center within 12 months. To achieve this goal, these 3 specific objectives were developed, each targeting one of the risk factors identified in the assessment. Objective 1 is to reduce musculoskeletal injuries by 40% through a safe patient handling training program and an introduction of mechanical lift equipment. Objective 2 is to decrease workplace violence incidents by 50% through mandatory de-escalation training and improved security protocols. And Objective 3 is to reduce burnout rates by 35% through on-site employee wellness and stress management programs. These objectives are specific, measurable, and are achievable, relevant, and time-bound, meaning they follow the SMART SMART framework we learned about in this course. The next is mapping, which means like identifying both internal workplace resources and external community resources that will help us implement the intervention strategies. Internally, we will utilize the hospital's occupation health department to conduct injury screenings and follow-up care, the HR department to distribute surveys and coordinate training schedules, the hospital safety committee to review incident data, enforce policies, and charge nurses to lead daily safety reinforcement on the floor. Externally, we will partner with OSHA, which provides free consultation services and training materials, the CDC and NIOSH, which supply evidence-based research and workplace safety toolkits, the American Nurses Association, which offers burnout resources and professional support, the Granger Industrial Supply, which will provide mechanical lift equipment, ergonomic tools, and sharps disposable containers, and the hospital's Employee Assistance Program, which offers confidential mental health counseling for staff experiencing burnout or workplace trauma. Each of these resources will be directly used in the intervention strategies coming up next. Now, we move on to the implementation phases, where I will describe all 7 intervention strategies designed to reach our goals, our goal and objectives. The first strategy is health communication. Safety reminder posters based on OSHA guidelines will be placed in all break rooms, nurses stations, and medication rooms. Monthly safety newsletter will also be sent to all staff, like an email, highlighting injury data, prevention tips, and upcoming training dates. This keeps safety visible and top of mind every single day. The second strategy is health education. Mandatory quarterly safety training workshops will be held for all nursing staff, each 1 hour long. Topics will rotate between proper body mechanics and use of mechanical lifts, de-escalation techniques for violent or agitated patients, and stress management and burnout recognition. These will be led by the occupational health nurse and a certified de-escalation trainer. And the third strategy is health policy. Hospital-wide mandatory safe patient handling policy will be implemented, requiring all nurses to use mechanical lift equipment for patients over 35 pounds. Zero tolerance workplace violence policy will be established with a clear 24-hour incident reporting requirement. Additionally, a nurse-to-patient ratio policy will be introduced to reduce workload-related burnout. The fourth strategy is environmental change. Mechanical patient lift devices and adjustable height beds will be purchased through Granger Industrial Supply and installed on all floors. Sharps containers will be placed at every bedside rather than just in hallways. Panic buttons will be added at nursing stations for immediate security response, and a quiet decompression room stocked with calming resources will be created on each floor for nurses to use during breaks. The fifth strategy is behavior modification. Charge nurses will coach staff on proper body mechanics, during patient transfers in real time, monthly one-on-one check-ins between nurses and their supervisors. Will use motivational interviewing techniques to identify stress and burnout early. Nurses will be encouraged to use the employee assistance program rather than pushing through than when feeling overwhelmed. And the sixth strategy is social intervention. A peer support group called RN Connect will be created, meeting bi-weekly during lunch and facilitated by a licensed social worker. This gives nurses a safe space to process workplace trauma, share coping strategies, and build community with their colleagues. Continuing education credits will be offered for attendance. The seventh and final strategy is insensitive and disinsensitive. As an insensitive, nurses who complete all 4 quarterly safety trainings and go 90 days without a reportable injury will receive a $50 hospital gift card and public recognition at all monthly all-staff meetings. And a disinsensitive, nurses who repeatedly violate the safe patient handling policy or fail to report incidents within the required timeframe will receive a formal written warning and be required to attend mandatory retrainings. And the final step is evaluation to measure whether the program was effective. The same anonymous digital survey used in the pre-assessment will be re-administered to all 120 nursing staff at the 12-month mark. The post-survey results are then compared directly to the original pre-survey data, as you can see in the comparison table on the slide. The results showed significant improvement across all 4 risk categories. Musculoskeletal injury reports dropped from 94 to 38, which is a 60% improvement. Neoslic injuries dropped from 48 to 18, which is a 63% improvement. Workplace violence reports were dropped from 67 to 24, which is 64% improvement. And burnout reports were dropped from 102 to 52, which is a 49% improvement. These results indicate that the 12-month workplace safety health promotion program at the Sunshine Medical Center was effective in reducing occupational injuries and improving the overall health and well-being of registered nursing staff across all 4 targeted risk areas. Thank you for watching my presentation.